The topic for you is role of NGO in health sector. So you have got around 1 minute time or more than 1 minute time. Now you can start.
Yeah, I'm going to talk about the role of NGO in public health. So basically, what they do is they act as a bridge between the people and the government. So whatever the plans, the policies that are created for the welfare of the people in the like mostly in the rural areas, they need in order to access them, like the policies to they need to get the awareness of the policies and the things, right? So this NGO they will try to go to the grassroots level and explain them whatever the whatever the things that should be that are given from the government and whatever the things that can be followed uh, to get the to access the particular scheme or the thing. So then the next thing is like uh, and also they are majorly working like we can see like in the rural areas there is a not a proper awareness about the sanitation facilities or like the basic health measures like washing hands or everything anything like that. So what they do is many of the time they give awareness to prevent the issues like diarrhea being the I think the diarrhea is the most uh, important cause of the child death. So being so for that easy way to avoid that is sanitation, proper sanitation. So they give proper learning what to do, what can be done, what can be done to prevent these steps, to prevent this diarrhea or anything kind of the virus infecting illnesses. And also yeah, now if we see a case of vaccination, we can see like the door to door. They made many steps to increase the vaccination percentage in COVID. Also, they came door to door. The NGO people came door to door and connected with each individual, collecting the data of whether they vaccinated or not, and they were able to they were able to work with the people in the grassroots. So these are the steps that I think this NGOs are doing to
Okay.
implement this.
Okay. This is good. I think you tried to cover the variety of points. The only thing that you could have done is you could have speak in more structured way. Like
Okay.
every time I say that, try to differentiate, like in awareness term what they can do, in providing health services what they can do, है ना?
Okay.
Or in training, in term of training what they can do. So the
Okay.
every point that you have spoke will lie under these three category. So what will
Okay.
happen if you say that in terms of awareness they can aware about
Okay.
their health, sanitation, vaccines, and health services which government is providing, what are the new challenges and what should be done at different stages of life, or ये सब awareness में आ गया. These all will
Okay.
come in awareness. Second, in health services providing, they can be instrumental in vaccination, instrumental in arranging health camps, instrumental in arranging different health services camp from government side. So these are the help they can role they can play in terms of healthcare distribution. They can also they can also be instrumental in providing or getting insurance to the people, health insurance to the people also. And
Yeah.
third, it is like training for health. So like they can train people to use different health practices, like how we do provide first aid, how do we find health, like even they can also promote the health practice, indigenous health practices also. So training and training part they can also cover. So if you categorize, even you will not speak one or two more points, that categorization will automatically cover all the points of that category.
Okay.
No, no, it's just thinking in a smart way. So if
Okay.
I'll say ki in awareness terms, so even the listener will assume everything. Ki, हाँ, yeah, this here also they can aware. So rather than giving 5 example of how they can spread awareness, you can just write or tell that awareness is a thing which they can effectively do because they are at very much grassroots level and they understand the people's language, and they can remove the people's confusion over the health services that is being provided. An example you could have given that in the time of vaccine, many people think that this vaccine should we should not take this vaccine. so they can go to the ground and make people aware about it. Okay.
Okay.
So it was good. It was good. I'll not say anything, complain anything to you. You will get good marks, even whatever you have spoke. But if you will structure it, you will get more marks. Okay.
Okay.
Sure.
Thanks.